recording later and you send your questions. How this will go is I will speak, and obviously I will share slides because I can't seem to be able to convey information without using slides. And feel free to ask your questions either in the chat box or in the Q&A box. And I will be able to unmute you if you have any questions, but you will not be seen. So you can join in your pajamas. Anyway, so I am Dr. Shabnam Das Kar. I'm a functional medicine doctor and I'm a brain health coach. And I decided at the beginning of this year that I'm going to focus on brain health, mainly because I have a brain and I want to keep it. And more importantly, I realized that even in my practice, I was not in a position to be able to focus on brain health because there are so many other things going on. Just as you have an annual health checkup to check whether your lipids are fine, your blood pressure is okay, your blood glucose is okay. Now all those things impact your brain health as well. But I can guarantee most of you have not had a brain assessment done just because, unless you had some symptoms. Now, by the time you actually have symptoms of dementia or cognitive decline or memory issues or any of those, that is kind of a little down the road. So my goal as a functional medicine doctor and a brain health coach is to prevent you from going down that path. That is okay. You might be thinking, I am young, I'm in my 30s, I'm in my 40s, dementia is not something that is going to happen to me very soon. Or I've even had people tell me that, oh, by the time I reached that age, they would have found some treatment. Now, unfortunately, despite billions of dollars being spent on research, there is no curative treatment yet for dementias like Alzheimer's. Now, I'll explain what is fatty liver and dementia. So bear with me for those of you who already know what it is. So number one is, of course, the subject, when I wrote it down a few months ago, I should have thought about it before doing it. So because obviously fatty liver does affect the brain. Otherwise, why would I have it as a topic? The question is, how does it affect the brain? So fatty liver is actually a metabolic disease of the liver. And the underlying problem in fatty liver is something called insulin resistance. And interestingly, your liver, you probably are wondering, how is my liver related to my brain? The fact is, your body is a network of networks. So it's not that the liver is independent of the brain or the brain is independent of the liver. Now, the major commonalities between liver health, or more importantly, fatty liver, because there are other liver conditions like hepatitis and all those, which I'm not going into. And so between fatty liver and dementias like Alzheimer's, there are many common risk factors, and insulin resistance is one of the major ones. So what is insulin resistance? If you've heard me speak before, I have talked about insulin resistance. So it's basically your body's, problems with dealing with the amount of carbohydrates you eat. So when you eat carbohydrates, and carbohydrates are food like, rice, pasta, roti, bread, pizza, cakes, all those things, a whole lot of grains as well, and starchy vegetables like potatoes and yams and all that. So some people have the ability to process carbohydrates well, either because of their genetics or they're extremely physically active for various reasons. But a lot of people all over the world have lost that ability to manage carbohydrates well. So what happens is when you eat carbohydrates, because of your carbohydrate insulin metabolism being impacted, the condition called insulin resistance, your body loses the ability to manage the carbohydrates well, and it shows up as what is called metabolic syndrome or insulin resistance syndrome or prediabetes. So you have different names for it. And how will you know if you have the problem? It's if you have diabetes type 2, not type 1, type 1 is an autoimmune problem. Type 2 diabetes is a problem of insulin resistance. If you have belly fat, if you need extreme exercise to manage your body composition, if you have fatty liver, if you have, there are a whole lot of mood issues which are also related to insulin resistance. If you have gut problems, some of them are related to insulin resistance. If you have raised liver enzymes, and I will talk briefly about that, all of those conditions, if you have PCOS, if you have hypertension, the commoner hypertension, there are some hypertensions which are as a consequence of something else. I'm not talking about those. These are conditions which are actually related to the underlying problem of insulin resistance. Dementia is, so Alzheimer's disease is the commonest dementia. And dementia is essentially like saying you have heart disease. Now, you know that heart disease are of many different types. It could be heart failure, it could be coronary artery disease, it could be a heart valvular disease. So likewise, the term dementia describes a whole bunch of disorders which result in a common problem of poor thinking, loss of memory, mood disorders, personality changes. But those are things that happen further down the line. My goal is to help you prevent those conditions. So Alzheimer's is the commonest type of dementia, but a lot of people with Alzheimer's actually have mixed dementias. And the other types are frontotemporal or from Parkinson's disease, Lewy body, or there are some other rarer ones as well. Bottom line is, even any kind of dementia, again, has similar risk factors, because sometimes when I have, spoken interchangeably between dementia and Alzheimer's, someone would get up and tell me, oh, you are not talking about frontotemporal, but then, or vascular dementia. But all of them have common risk factors like your insulin resistance, good heart health, good blood pressure, optimal blood pressure. All those things are important. So yes, I might talk interchangeably about dementia and Alzheimer's, but remember that I'm talking about the common things. So the common risk factors between fatty liver and dementia, the most important one is insulin resistance. But the fact is, both now the risk of the incidence of dementia is rising dramatically worldwide. Yes, one important factor is people are living much longer, no doubt, but that is not the only reason. And unfortunately, in medium and low income countries, developing countries, the number of people living with dementia is going to rise dramatically. Whereas in first world countries like Canada and the US, North American countries, several European countries, it has remained kind of stable. In the next 20 to 30 years, the number of people living with dementia worldwide is going to be much higher. And at the same time, fatty liver has become like an epidemic. Even children having fatty liver has become much more common today. So obviously, fatty liver and your brain health are intimately related. So I'll just briefly describe. Now this, I and my associate, Dr. Natasha Iyer, we had recorded a video on fatty liver disease, whether it is a lifestyleable or a druggable problem. Now, obviously, I'm biased towards lifestyle. So that would be sort of part 2 of a fatty liver disease, but we don't talk about the brain in that. That has more to do with fatty liver. So I will send the link to that video as well, and you're going to receive a recording of this. So what happens in fatty liver? Now, this is a microscopic picture of what your liver looks like. So non-alcoholic fatty liver disease, it results from liver damage because of accumulation of fat. Now, what is the fat that accumulates in the liver? All of you have had a lipid profile done, which shows one of the different lipids is triglycerides. So triglycerides accumulate in the liver. Now, obviously, the question comes, why does that happen? And I'll briefly explain that. And because of that fat accumulation in the liver, there is also inflammation in the liver cells. And that inflammation is extremely important because, as you know, chronic inflammation is related to 95% of long-term of chronic disease like heart disease, stroke, dementia, mood disorders, gut issues, and autoimmunity. All of them are related to chronic inflammation. But here we are talking about inflammation in the liver. So this is the different stages of fatty liver. As you can see, this one is a healthy liver. And hepatic steatosis. So hepatic is liver, and steatosis is collection of fat. So this is basically what is fatty liver. And so non-alcoholic steatohepatitis, and no apologies for these long names, but it explains something. Non-alcoholic meaning it does not, as you know, alcohol is a major toxin for the brain as well as the liver. So this is someone who does not have a problem with excessive alcohol intake. So non-alcoholic steatohepatitis. Steato is fat, and hepatitis is inflammation of the liver. So any word that ends with itis implies inflammation. And then the final stages are liver cirrhosis, liver cancer, and finally this thing is when someone needs a liver transplant. Now, what I want to highlight here is you can see all these initial stages are reversible. And this is the cirrhotic stage, is when you need a liver transplant and all that. That is irreversible. So my point is there is a lot of things you can do when it is still in the fatty liver stage and does not go on to become, increase inflammation, liver cirrhosis, fibrosis of the liver, and then you needing a liver transplant. So this is where I like to focus on, because liver cirrhosis is, I'm not a hepatologist, so that is not my area. My area is here. So now, where does this fat in the liver come from? Obviously, I talked about insulin resistance before, so higher carbohydrate intake. Now, obviously, the question I'm sure you're wondering is, what do you mean by higher carbohydrate intake? And I have talked about, personal blood glucose response before. And if you would like to revisit those videos, every time I send you the recording, I also have the previous webinars in that, the links to previous webinars. So I would suggest you go through one of those. So each of you is different. Now, some of us, like I'm of South Asian ancestry, I'm originally from India. We are, genetically, we are at a much higher risk for diabetes, heart disease, and of course, by default, dementia. So my carbohydrate tolerance is very low. It's probably around 30 grams a day. One apple is 20 grams. So you can imagine, if I even look at things like rice or roti, I not only gain weight, I don't have fatty liver, but I struggle with maintaining my body composition. I struggle with weight loss because of these reasons. And of course, there are a lot of other reasons as well. Stress can raise your blood glucose levels also. So what is your carbohydrate intake is, what is the right amount for you is different. There are different ways of finding it out. I'm not going into that today. So higher carbohydrate intake than what your body can tolerate, it accumulates as fat in the liver. The next is, our bodies have the ability to make fat. So it's called de novo lipogenesis. So making fat in the liver from glucose, fructose, and amino acids. So one of the major associations of, fructose causing problems in the liver is something you need to keep in mind. So when you have fatty liver, number one is you need to look at, are you drinking a lot of sugar sweetened beverages? So soda and, things like what in India are called cold drinks. Those are very high in fructose, and fructose is deadly for the liver. It does not raise your insulin levels. It does not raise your blood glucose levels. So you won't even know what mayhem it's causing in the liver, because you cannot see your blood glucose rising or your insulin levels rising. So the other important thing I wanted to highlight is, and again, there are common risk factors between fatty liver, heart disease, dementia, all of them. And most people with fatty liver do not die of cirrhosis or, liver cancer. Most of them die of diseases of the heart and brain, things like stroke, heart disease, coronary artery disease, heart failure. So cardiovascular disease includes all of those. So the commonest cause of death in patients with non-alcoholic fatty liver disease is actually cardiovascular disease. And this is a surprise to many of my patients. I have a problem with my liver. So why is it my heart that is affected or my brain that is affected? But like I said, our bodies are a network of networks. So everything is related to everything else. Now, I describe fatty liver as diabetes of the liver, and a lot of my colleagues will tell me, for you, everything seems to be about diabetes. Like dementias are diabetes of the brain. So Alzheimer's disease is considered to be type 3 diabetes. And I will talk about, heart disease being diabetes of the blood vessels. And PCOS is diabetes of the ovaries. So likewise, fatty liver is diabetes of the liver. So diabetes has become all pervasive, but you might be thinking, I don't have diabetes yet. The question is in yet. So what is diabetes? Diabetes diagnosis is essentially when your blood glucose levels have gone beyond a certain level, you are considered to have diabetes. But the unfortunate thing is a lot of the problems, and particularly problems related to the brain, are related to less than optimal blood glucose levels. So you don't have diabetes today, you're not diagnosed, your doctor doesn't say you have diabetes and you need to be on medications, but your blood glucose levels are climbing, they are higher than optimal. Or as you can see, this is the continuum. Some people start with PCOS, women, even adolescent girls, then pregnancy, diabetes, high blood pressure. And it's not like this goes in, this kind of an order. Some people may, have high blood pressure way before anything else, particularly young men. Then belly fat, difficulty losing weight, fatty liver, abnormal lipids, heart disease, diabetes, and I don't have one more here, where diabetes is one of the highest risk factors for dementias like Alzheimer's. So I should add that here as well. But all of you are familiar with the problems of diabetes, or at least I hope you are. But you don't think that your high blood pressure pills that you've been having for the last 7 years are actually related to the underlying problem of insulin resistance. So this is just an aside. I was checking out some stuff on what do the worldwide, all the medical associations talk about fatty liver. And one thing I found, like, are you kidding me? It's like, which is the chicken, which is the egg? So one of the things they mentioned is one of the risk factors of fatty liver is obesity. The problem is which came first? The obesity is very likely from the underlying insulin resistance, which is what caused the obesity as well as the fatty liver. So it's not like because you have more body weight, you have become, you are at a higher risk for fatty liver. It's just that the underlying problem is the same of insulin resistance. So it's not different. Liver has a different problem, brain has a different problem, the heart has a different problem. So this is the type 2 diabetes continuum. And I have already talked about this before. Your body does not behave independently. The liver is not independent of the brain is not independent of the heart, and none of them are independent of the gut. So, but in traditional medicine, we look at neurology, cardiology, OBGY, endocrinology, all these specialties separately, versus in functional medicine, we look at them through several different commonalities: insulin resistance, chronic inflammation, nutrient depletion. And this is essentially how we as functional medicine doctors look at your health. Now, in fatty liver, so far as I know, we haven't found any connections with long COVID and fatty liver, but we might, because it's probably too early. It's just been 2 years. But a COVID infection can completely, disrupt your blood glucose regulation. A lot of people have had problems with their diabetes, controlling their diabetes. New diabetes has developed. So it won't be a surprise if we find that people who've had COVID infection in the past, somewhere down the line, they start developing problems with a fatty liver. And already we have a few studies showing problems of, a higher risk for Alzheimer's, and Alzheimer's takes 20 to 30 years to develop. So obviously in 2 years, we won't know, but the risk factors for brain dysfunction are going up in people with long COVID. So this is something we need to keep in mind. So nowadays, every patient, I make it a point to ask, did you have COVID? Do you think your symptoms were worsened after COVID? So that is something I have to keep in mind. And if you are one of them, just bear this in mind. Not that there is nothing you can do about it. It's the same, because for long COVID, there is no specific treatment yet, just as there is no specific treatment for fatty liver or for dementia as well. But there are a lot of things in terms of your lifestyle changes that can help you. Now, again, I have already talked about this. What I want to highlight is these are just 3 of the papers out of a whole bunch, but both of these papers are in the prestigious journal called Neurology. So neurology is in the world of neurological diseases like Alzheimer's. This is one of the most, important journals. And this particular paper is just from last month. So if you talk to your doctor, you have fatty liver and you feel that you have more brain fog, you're forgetting things, you don't feel your brain is as rapid fire as it was before, and your doctor says, oh, the two are not really related. So bear in mind that this could be new information that hasn't reached your doctor yet, but you are here today and you know that, yes, they are related. So, and for us, it's not a surprise because, again, like I said, the underlying problem of insulin resistance, is common to all of these conditions. So here I'm going to pause for a sip of water. If you have any questions, please feel free to ask. Either you can type in the chat box or in the Q&A box. Or if you raise your hand, I can unmute you as well. Okay, I can see a raised hand. 1 minute. Let me figure out how do I. Okay. So, Amy, you can unmute yourself and ask.
Yeah. Hi, I was late because my Zoom doesn't work on my phone today, but that's okay. I can refer back later when I receive the recording. My question was, when you talk about the fatty liver, how do we know we have it?
Yeah,
Something
I'm
wrong
coming
with our
to
body?
that. So,
Oh, okay. The next one related was glucose. Like I checked the ingredient label when I buy food. Sometimes they said no sugar, but they said it's like edible glucose. Is this worse than sugar, or this is the thing I'm wondering?
Okay, very good question, Amy. So glucose and sugar. So the most important thing when you look at the labels, what you need to look at is the total amount of carbohydrates, because many a time you will find that it says no added sugar and you think that it will not have sugar. But because carbohydrates are things that become sugar. So they are not sweet, things like rice and pasta and these things, but they do become sugar in the body. So it's either sugar, white table sugar, the thing that is sweet, or things that become sugar like rice, pasta, and all these things. So now going to, Amy, now moving forward, you are going to focus on the total amount of carbohydrates on that label. And the other thing is, isn't it interesting that most of the food which don't have carbohydrates, things like fish, meat, or even some cheeses you can probably find the nutrition information, but you don't find any nutrition information coming in the produce section or in the the meat section. They never come with labels of added sugar or this or that, or well, it shouldn't be. And again, processed meat is a different story. So basically, yes, so there is a connection between the two. And how do you know? So, Amy, to answer your question, how do you know if you have fatty liver? The commonest way people find out about fatty liver is if they have an ultrasound examination of the whole abdomen. So it's not just the pelvis in women, it's an ultrasound which includes the liver. Very often you will find that is where you come across this, you have fatty liver. And the other thing is, routine annual checkup, or even for any other reason, you might have gone to the doctor and you do a blood test. So a blood test panel usually includes a test for liver enzymes. Now, liver enzymes are ALT or AST. In some countries, they are called SGOT, SGPT. And they are not dramatically raised, but they are minimally raised. So minimal rise in those. Then there is another liver function test, which is not always done, called GGT. That can be high as well. So these two, SGOT, SGPT, or ALT, AST, is the same thing. The optimal levels for both of those is 20 or less, but you will find that the lab levels are usually around 35 or 40. So you may have it at just minimally raised, not severe liver disease. Like, some people actually, even with COVID, have had elevated liver enzymes. but it's like maybe 50, 60. I've seen higher than that as well in my patients with fatty liver. So that is one. Then there is an online tool, which I think I didn't add that tool here. Sorry. So there is an online tool called the FIB4 score. So I think what I will do is I'm going to add the link to the chat box so that all of you can check it out. Let me first find the link to the FIB4 score. So the FIB4 score is FIB4 calculator is available free online. And I'm going to post the link. And as you can see, it takes your age, your platelet count, your AST and ALT into account. So I am going to share this with you. And this is information that, all of you can get from your routine lab tests. So you don't need some specialized testing. Your platelet count, your ALT, AST, and age. These are the few things that you need for the FIB4 score. And once you do the scoring, you will see, what is the next step. So sometimes if the FIB4 score is high, then your doctor is going to send you for something called a fibroscan. So that's a specialized testing. And then if the fibroscan score is high, then you might need a biopsy to confirm problems of the liver. Now, biopsy is an invasive procedure. So someone with fatty liver is never asked to go in for a biopsy. Usually fatty liver, if we find on ultrasound and raised liver enzymes, we can start acting on it right away by reducing carbohydrate intake, therapeutic lifestyle change. I'm coming to the modalities of treatment very soon. So those are the ways you can look at it, but not everybody needs a liver biopsy to confirm fatty liver. But when it comes to liver fibrosis or steatohepatitis, those, and again, this will depend on your doctor is going to decide when you need a specialist referral, or if you're already meeting a specialist, when you should have a liver biopsy. My point is not everybody needs a liver biopsy. What I tell my patients is I don't even recommend a fibroscan early enough. I said, let's try to do a few things that can reduce your liver enzymes, make your fatty liver go away, reduce your triglycerides. And then we can, probably check 3 months, 6 months down the line, if your liver enzymes have not come down, or you're not able to maintain the lifestyle changes, then we need to look at fibroscan and all those other things. And then, of course, if the fibroscan report is not good, then I send my patients to specialist hepatologists. Because by that time, if they have already gone into cirrhosis, it's outside my area of expertise. But my point is, yes, a lot of it can be prevented and you can manage your fatty liver quite well through lifestyle changes. I'm going to go back to sharing the screen. So, okay, so this is where I was, and so lifestyle intervention is the fundamental and only treatment for non-alcoholic fatty liver disease. Sorry, I got the wrong set of slides. I'm going to stop sharing. This was my other slides, which were from the longer presentation with Dr. Iyer. So I'm going to close that and, oh, what's going on? Sorry. So Amy, does that answer your question about the diagnosis?
Actually, I tried to get an answer from you, yes or no. I was wondering if I choose the food, does it make which one is better? If it says added sugar, and then the other one I believe would be refined white sugar. It's no good, but the other one would say edible, just no sugar, but just contains some glucose. Which one should I choose?
Choose the one with the least amount of carbohydrates, whatever they call it. They call it sugar, they call it whatever. The number you need to focus on is carbohydrates, and don't focus on the amount of fiber, net carbs. No, just look at the total amount of carbohydrates.
Oh, okay. Okay.
Okay. So Now, this is again, some of you love to know the scientific details of what is exactly going on. How can the liver impact the brain and all that? So you can see neuroinflammation, insulin resistance, all these vascular problems, gut dysbiosis. But one thing which is unique to the liver is what is called hyperammonemia. Ammonemia, sorry, in long terms, big words. So when people have severe liver disease, many such people can have something called hepatic encephalopathy. Hepatic as in liver, encephalon is the brain, so any pathy meaning any disease. So people with severe liver disease may present in the hospital with brain problems and a lot of abnormal behavior and things like that. So they are diagnosed as being in hepatic encephalopathy. And in such patients, when the liver has a huge reserve of function. So for someone to go to that stage of hepatic encephalopathy, it's very advanced liver disease. And that liver disease can be from hepatitis and other conditions as well, not just fatty liver. But in severe liver disease, high ammonia levels are the ones that impact brain function. Now the question comes, and as I mentioned before, some of the research is very new. So the question has come up quite a few times whether, see, when the ammonia levels are very high, now normally no one is going to check for ammonia levels in your blood as a routine test. If you don't have symptoms of hepatic encephalopathy, no one will check for ammonia. So the question has come up that is it possible that lower levels of ammonia, so they are not super high to cause encephalopathy, but they are higher than normal. So is it possible that that high ammonia level impacts brain function? We don't know yet because we have to do studies in people with fatty liver and no brain dysfunction, check their ammonia levels, then follow them over a period of time to see if the ammonia rises and their brain dysfunction kind of matches that, and the liver disease worsens as well. So, but that is possibly one of the pathways. And so obviously the next thing comes, how do you treat? And the treatment part of it, actually, Dr. Iyer and I have discussed that at length in the other video. But most importantly, there is no one single drug for fatty liver. And just as there is no one single drug for the treatment of dementia. So fatty liver does not have one specific treatment. The best treatment for fatty liver is significant weight loss. So lifestyle management, and if you are someone who struggled with weight loss before, you know that it's not very simple. It's not just eat less, move more. So therapeutic lifestyle management there are studies supporting that. This particular trial is very interesting. It's called the DIRECT trial. This was done in the UK. This was not done for people with fatty liver. This was done for remission of type 2 diabetes. So remission of diabetes means you were diagnosed with diabetes, your blood glucose levels were high, you may have been on medication or not on medication, but you made certain changes in your, and I'm going to talk a little bit about the DIRECT trial because it is really fascinating. You did certain things, and then you reached a point when you no longer needed any medications to maintain your blood glucose levels at the normal level. Now, we don't say, cure of diabetes yet, because that has not happened yet. So remission meaning if you continue to do those things, if you continue to reduce your carbohydrate intake, maintain your body composition well, you will remain non-diabetic. But if you stop doing all those things, your diabetes can come back. So it's not like treating an infection. Once you treat a urinary infection with antibiotics, infection goes away and you are cured of it. So in diabetes, we don't talk about cure yet. So what did they do in the DIRECT trial is they did a complete meal replacement. Now, sometimes, I find people telling me, but Dr. Carr, you always talk about food. Why are you talking about a meal replacement? Now, this particular meal replacement, and you can check this, the DIRECT study, just go to your internet browser and look for the DIRECT trials. You will find that there's a company, they have a total meal replacement. It's called the Counterweight. counterweight something. So it's a powdered, it's a shakes and soups and things like that. So what they do is people are given those total meal replacements. So they stop eating all kinds of food and they only eat the meal replacements. And the meal replacements are special because they contain a whole lot of nutrients. And the total calorie content is about 800 calories a day. So I'll find my colleagues telling me, but Shabnam, you are talking about a low calorie diet. I'm talking about the direct trial. So what they did is they put people on this 800 calorie diet of total meal replacement. And over a period of time, what they found is people who lost a massive amount of weight. So this is like 11 to 15 kilograms of body weight. So you can multiply that by 2.2 to know the number in pounds. So when people lost that massive amount of weight, their liver fat disappeared. And once the liver fat disappeared, the fat in the pancreas went away as well. And once the fat, so the pancreas is the organ that makes insulin. And once the pancreatic cells lost their fat, they were able to recover and start producing insulin and become insulin sensitive again. So that is fascinating. This is the first study that did it. Now they are in the maintenance phase. So obviously that kind of massive weight loss on a low calorie diet, it's not so easy to maintain it, but few people have managed to do that. So they have maintenance phase, they have initial intense phase. Now, many of you will probably think, if they could do that with a meal replacement, can't I do that with food? This is where the problem comes in. So with food, number one is, it's not, see, every day if you wake up and you don't have to think about cooking, like, is this more than 100 calories? So am I going out of my 800 calorie planned diet today? Am I doing this? That creates a lot of cognitive load, versus that you are not going to eat any food for the next several days and you're only going to eat this meal replacement. So lots of studies have found, and you just think of it yourself, you don't have to worry about breakfast, lunch, dinner, none of it. You don't have to cook that, don't have to shop for any of that. You just know that you're going to have these powders, and that is going to take care of your nutrition as well, not just food. So when it's a meal replacement, number one, compliance is easier. It's much easier to stick to that than having to think and worry about, what should I eat and what should I not eat? Am I getting outside my plan? So that is why total meal replacement is very different from trying to, imitate that and do it with food. Because with food, you will not get all the nutrients that are there in that particular, the meal replacement. And they don't pay me to talk about it, but I'm saying it's very nutritionally dense powder. It's not just, and if you are in the UK, you can probably reach out to them. It will be available. As far as I know, it's not available in other parts of the world yet. The third thing, that are there medications? Now, like I said, there are no medications specifically for fatty liver, but there are medications which can help in reducing weight. So in the other video, we talk about a trial where they use something called semaglutide. Again, I'm repeatedly saying those were trials not just to look at fatty liver. They were essentially to look at massive weight loss. So once a person is able to lose a significant amount of weight and maintain that, many a time the diabetes goes away, and with diabetes going away, the fatty liver goes away as well. But for a lot of you, if you don't have diabetes and you don't have like severe problems, you may not need to lose a huge amount of weight. I have had patients who have not lost much of weight, but eating a lower carbohydrate diet, practicing time-restricted eating has helped them in reducing their liver enzymes. Their fatty liver has gone away when they repeated their ultrasound in 1 year. I don't normally ask my patients to repeat ultrasounds in less than a year, because most importantly, my treatment recommendation is not going to change. So what's the point in just repeatedly going for more and more studies? But I would repeat the liver enzymes every 3 months to see the trends. Which way is it going? Is it reducing? Is it stable? Has it gone up? All those different things. So basically, fatty liver is reversible, and most of it is related to your lifestyle. So I am going to end the PowerPoint slide. And if you have any questions, please feel free either to raise your hand or you can type in the chat box. And Amy, I'm so sorry. I don't know how to, remove if I remove you,
Oh,
will
that's
you
okay. I was about to ask you a question.
go
Then
ahead? Yeah, please
probably
go
I
ahead.
will finish. Oh, from what I understand, about this thing, carbs, carbohydrates,
Mhm.
is this like we must limit them to 800 gram a day, right? That's the level to
Okay.
maintain your health.
So, Amy, what happens is each person is different. And again, whatever I'm saying is not medical advice. So is it 100 grams? Like I said, my tolerance is probably around 30 grams. So you will need to figure out, and I think you were on that webinar when I talked about personalized blood glucose response. And don't worry if you don't remember that, because I'll send the recording again with all the
I
other
think so.
recordings.
I've been attending all of you,
Yes.
your except the one, the first one I missed. So I asked you about the recording. Yes, I will go back to all of them again.
Yeah. Thank you, Amy,
Basically,
for being such a faithful,
oh,
person
thank you,
joining me. Thank you very
Taka.
much.
It's very helpful information because you in the field, you got the most advanced info from all these scientific research and trials. But how do we actually figure out what is my level?
So the best way to figure out is actually using a continuous blood glucose monitor. So this is a wearable device, a small little
Oh,
has a small needle and you wear it. But just wearing it is not enough because you have to track your responses to individual food. So let us say you don't have to keep poking yourself every time to check your blood glucose levels. And again, depending on which country you are in Canada, you can get those devices without a prescription. Uh, and many countries you can get them without prescription. In the US, I think you will need a prescription for many of them, but there are lots of companies selling them now. So one is you wear that device, so it checks your blood glucose levels in the background. You don't have to keep, using a finger stick. Then what you do is you track your food. So let us say before you eat your breakfast, you check your blood, scan that and see what your blood glucose level is.
mm,
And then you eat whatever your favorite food is. Now the thing is, you are not eating just carbohydrates. You are eating, let us say if you eat rice, you are going to eat
yeah,
some
mixed.
meat and
Yeah.
some vegetables with it.
Mm.
So how your body responds to that particular food, you may find that, like I found when I used a continuous blood glucose monitor, that rice does not raise my blood glucose levels as much as some of the grains. So some of the
Mm.
Indian flatbreads, the rotis, they raise my
Mm.
blood glucose levels a whole lot more than rice. But risotto, so that arborio rice, that raises
Mm.
my blood glucose very high.
Oh gosh.
So each person is different, Amy. So you may respond, to one particular food with a very even blood glucose levels, whereas my blood glucose levels can go into the diabetes levels. And sometimes blood glucose levels may go up in 1 hour, not in 2 hours. So normally we used to check for, you do a post-meal blood glucose report, you eat your food, and then you go to the lab and give it after 2 hours. Some people have a peak at 1 hour. So you may be, so many people who have used the CGM have found that some of the food that they thought were very healthy, things like beans, and of course, the Indian flatbread gave a lot of my Indian patients really big shocks. Another shocking thing they found was milk tea. So in India, people drink a lot of milk tea with sugar. They thought, okay, I've given up the sugar, so the milk and tea should be fine. But they found that the milk in the tea raises their blood glucose a
As
lot.
sugar as well. Mm.
Yeah, so that is carbohydrates too. So the thing is, that is the best way for you to find out. Or the other way, if you don't want to use a CGM or anything, and you feel that, based on all the things that I've been talking about, that you have insulin resistance, you can reduce your carbohydrate intake, from what you are eating today.
Mm.
And there is a very nice, easy, simple graphic. I think I had shared it last time. Dr. David Unwin, he's a family doctor in the
Mm-mm.
UK. He's made these spoonfuls of sugar graphic. I think, Amy, I should be having your email ID. I'll send it to you. So I'll send it to everyone in the, who's listening, because I find that very simple. Like, for example, a banana is 6 spoons of sugar. So likewise, egg is 0 spoons of sugar. Broccoli is 0 spoons of sugar. bread. So he has made, this is a calculation. So those are very easy to follow. So you can use that and, see your before and after blood glucose levels and weight and how you feel, all those things, and check that also. But some of my patients, they like to see the data, so they want to go for the CGM. So you can do it in many different ways. So I think that answers your question. So do we have,
So I'm just wondering about the rice. You said the rice didn't actually show up in your monitor. What type of rice is this? The the long grain or the what they basmati?
yeah, so I had tried it with
Yeah,
basmati, but the
yeah.
risotto, so that is that arborio
Yes,
rice,
yes.
that raised my blood glucose a lot.
I actually read it somewhere said basmati has less
Oh,
starchy
no, no,
than
no.
the
It
rounded.
depends. It's nowadays
Really? Or
basmati is
maybe
very
it's
refined.
related. Not sure. Yeah, but it looks like we'll have to self-check and
Yeah,
monitor it. Thank
yeah.
you. Oh, actually, last bit. Are you going to continue with your series of webinar? Because I thought you might get back to the functional medicine
No,
overview, that
I'm
kind of.
going to continue with brain health, but probably I'm
Okay.
going to take a hiatus for 1 or 2 months. I haven't decided.
Okay.
And and this is a request to everybody, if you have any specific topics you'd like me to cover, I'd be happy to do that. Because truthfully, everything is related to the brain. So it's not like I'll be talking about things that are not related to the brain.
Right. Thank you.
Okay. So anyone else has any questions? You can feel free to raise your hand and I can unmute you, or you can type in the chat box. So look out for another thing I wanted to mention is sometimes my emails may be going into your spam folder or your promotionals. So if you just add info, INFO, @drkarmd, drkarmd.com to your contact list, then it's chances are high that they will not go into your spam. And you can also check if you're using Gmail, if it goes into promotions, you can make it into your primary and then not miss out on the announcement emails of the next topics or whatever else is happening, or some podcast I might have recorded, a whole bunch of stuff. Okay, I don't see any more raised hands or any questions.
Sorry, doctor, the chat was disabled. Probably people didn't actually had the.
Oh, the Q&A is enabled.
Oh, Q&A. Okay, I see. All right. Okay, I'm done. Thank you so much. Probably if I do have issues, I will email. I actually got your email. Thank you.
Okay.
See you next time.
Thank you. Yes, we do have a question. Can you please put your email in the chat? I missed it. Oh, I'm so sorry. Yes, I will do that. So I am going to put it in the chat box and I'm going to wait for you to, I don't know whether you can copy paste that. So if you have received this email information about this webinar, then you definitely have my email ID. So you probably just need to check. Okay. And please feel free to, suggest any topics that you'd like me to talk about, because obviously I need to know what it is that, you are looking for, not what I want to tell you. Okay. You're welcome, Julie. So bye now. And look out for the announcement. And maybe we are going to launch our podcast is already there. We just want to make sure we have enough episodes for you to listen to before we have sort of a launch of our podcast. Maybe that's going to happen in October. I'm not sure. Bye.